The most important skills are knowing how to extract teeth, how to manipulate tissue, because that's just part of the surgeries, and being able to work through surgeries, through cases efficiently. Good implant dentists know how to start a case efficiently, go A to Z and get a good outcome. Doctors that may struggle, they get tied up on certain aspects of the procedure, drags the procedure out for a long time, and that makes it challenging because then the sedation starts to wear off, anesthetic starts to wear off, patient's getting a little bit antsy. But really all of it starts with the foundation. If you can get teeth out, do extractions, and then in an efficient manner, all the rest is easier more or less to pick up. So first, I reassure them that it's okay to be anxious, it's okay to be nervous, because there's always a first for something. Even if you've done lots of cases, at some point you're going to encounter some first time something happens on a case, and so you can't get really worked up because it is a big procedure. You can't get overly stressed. You just have to think through the fundamentals of your training and know, okay, this is the road bump, the roadblock I'm up against. How am I going to navigate around this? Just try and stay as calm, cool, and collected, and then whatever you decide your plan of action is going to be, then just go execute that plan. And so also, the more reps you get, the better you get at managing roadblocks. There might be things that come up where it used to be a wall and now it's just a little bump in the road. You don't even think much of it. It happens, you navigate it, and it's not a big deal. There's a number of things with dental implants there's a lot of nuances with dental implants. So somebody that does not have a lot of reps under their belt, doesn't have the clinical skills or knowledge or background to kind of back up the procedure they're doing, that's going to very much come through to the team, to the patients. Doctors that are confident, they have a foundation, understanding, the adequate training, that not only in their confidence to the patients, but with the teams, it goes a long ways for having a good outcome for the patient, and also having the team support and back the dentist in the treatment they're offering. I think cadaver courses for full arch is super important. Also, I think having just like a foundational all-in-X course where you learn all the nuances from pre-op design, like your records, treatment planning, execution, all the prosthetics, that's important to have a good grasp. But really for the actual surgical execution, I think a cadaver course is very good. If you can do a live patient surgery course, that's great too. But those are super expensive, and also there's a number of things that limit the availability of those. So it can be challenging at times, but I try to focus on my number one priority is my patients in my office, and I feel like it's my obligation to help as many patients as possible. So my production in my office, that's basically my metric of helping those patients. So if we're not getting those patients through the finish line so they can access the treatment, that's a problem for me, because they're my number one priority. Also, with my role with SPG, there's a lot of other doctors out there that are in our network that are trying to help their patients. So it's kind of like an exponential effect, I feel like, in that sense. It can be challenging. It's a lot of multitasking, but yeah, it's fun. I like helping patients. I like mentoring and teaching doctors. So it's a good mix for me. I think the most successful offices, they have good communication. There's a good level of a baseline level of trust, and they want to help as many patients say yes as possible because they know what it can unlock for them. And so really having that vision in mind that drives their performance. It's like, that's why we're going to make the phone calls to these patients, or that's why we're going to do this with our scheduling to make it a little more tidy and organized, so we can just be more efficient, so they can help more people. But having that vision and then good communication to execute, I think that's probably what the teams that do best, what they do. A lot of these patients, they've been struggling with the condition of their teeth and their mouth for years. Like, chances are they've probably been in some pain or some amount of discomfort, even if it's not like physical pain. Like, let's say you're missing your back teeth, you can't really eat and chew your food. It might not be a physically painful, but that's like a painful experience to not be able to eat foods that you once enjoyed, and also foods that are healthy for you. And so they've already done the hardest part. They've already had years of struggles, and they're looking for solutions, and we have the solution for them. And so really the procedure itself is just the start of their new life. It's not so much the start of this process that's it might be a little bit scary, but really for me, I see what their future life is holding, and not so much like just the healing from the procedure itself. I think, many patients have just said, I wish I did this sooner. You deliver their teeth after the procedure, they look in the mirror and they start crying, and they just say thank you, and that they wish they would have done it sooner. Numerous times in my career, I've had patients that are like, I just wish I would have done this sooner. And the reality is like, a lot of patients, they didn't even know this was an option, and also they might not have even realized how affected their life was until they had their new smile back. A lot of patients are more and more interested in dental implants. A lot of patients don't like the dentist. They avoid the dentist until it becomes too late. But like with SPG, we are trying to open this treatment offering to as many patients as possible. And so I see more and more patients transitioning to the implant route, because they're going to see advertising from offices like ours of, you can get a new smile, new teeth in a day, not have to be in a denture. Like, they don't know all their options. So I really see more full arch patients over the next probably 5 years. Really forever. I don't really see this trend reversing, because that's just the nature, I think, of our mouths and things breaking down and wearing out over time. So